Hello, my name is Dr. Natalie Tinney, and I am a second year family medicine resident at the Ronge Medical Clinic. This is a list of community health resources that we have put together in order to provide the members of our community a list of reliable, high quality resources about common childhood and family illnesses. If your child is very sick, meaning if they aren't drinking water, if they are working hard or struggling to breathe, or if they are sleeping and you cannot wake them, or if they have not soiled their diaper in the last 8 hours, please hang up and dial 911. So, this is a list of resources that were created by qualified and licensed health professionals. In this day and age, it is very common for us to be exposed to lots of information, be it from search engines, from Google, websites, or from social media. So this is a list of high quality resources that we hope that you will find useful. The first one is from CHEO. CHEO stands for the Children's Hospital of Eastern Ontario. And as we can see here, we have an encyclopedia from A to Z of common childhood illnesses and links to their respective resources and supports. For example, if I click on head injuries, I will be taken to this page. It is important that this resource, as well as any online resources that are included in this video, are for educational purposes only. And if you have any questions, you should get in contact with a healthcare provider. So if we click on the link, we'll get to Fast Facts, and then it will bring us to a link. And the link will bring us to an online handout, which will explain things like, for example, what a minor head injury is, what symptoms they might be experiencing, and also when to bring your child into the hospital or when to dial 911. So this is the full list. Or for example, if a child has fever, we can click on fever and it will bring us to this page, which will give us information about what a fever is and why children present them. It'll give us a febrile seizures, when to take care of how to take care of a child at home, and when they should visit the emergency department. So if we go back to our list here, the second resource I would like to present to you is Caring for Kids. Caring for Kids was created by the Canadian Pediatric Society, and it has a wide range of resources on different topics. So if we click on, for example, immunization, it gives information about the vaccines or about development and the milestones that we should be expecting children to be reaching. And it also has links about healthy development, learning and playing, neurodevelopmental disorders, as well as some parenting guides. So this here is Trek. This is a resource that was created for both healthcare professionals and for caregivers. So TREC stands for Translating Emergency Knowledge for Kids. So if we go here, we go to the healthcare provider resources. So these are some bottom line recommendations. And then if we go to this part, this is the ebook. These are the ebooks. Ebooks are illustrated online storybooks about common presentations that children may present. So if we click on this link, it will bring us to an online storybook. The text will be more at the top. And if we click through the pages, it'll also give us some audio files that we can play. And it'll also give us some highlights. So if we click on the important, it gives us important facts about the illness. Like so. The next resource I'd like to present to you is about kids' health. which was created out of the Hospital for Sick Children in Toronto, Ontario. So, this resource about kids' health, this also has featured articles about new illnesses, and it also has resources that are divided by the different age groups of children. And it also has handouts on specific illnesses. For example, in wintertime, it is very common to see outbreaks of RSV. So by clicking on this link, we have information about what it is, signs and symptoms, risk factors, treatment, prevention, and when to seek medical attention. The next resource I'd like to present to you is from our own province. It is the Saskatchewan Prevention Institute, Child Health and Parenting. So for example, we go to the top, it'll say select a topic, and if we click on the down arrow, it'll give us a lot of topics to choose from. Also, near the bottom, it also has links on common childhood illnesses. For example, if we click on ear infection, it'll explain what it is, common symptoms, when to see a healthcare provider, treatment, as well as prevention. The last resource I would like to present to you is My Health Alberta, which is another encyclopedia on health conditions from A to Z. This is a list, and it not only includes childhood illnesses, but it also includes topics like child safety. So, for example, we can click on child car seats, and it will also give us information about why child car seats are important, when to use a rear facing car seat versus a forward facing car seat, when to use a booster seat, when it's okay for a child to be using only the seatbelt. So this is, once again, our list. If you continue further down the document, you will see that we also have created direct links for common illnesses that are seen in primary care. For example, fever, common cold and respiratory illness, lice, ear infection, chickenpox. And this last one here is about making decisions about medical tests and treatments. So sometimes when a caregiver or parent brings the child to the doctor, sometimes they are not prescribed a certain medication or a certain inhaler, or sometimes they are not ordered a certain test, such as an x-ray. This website helps parents and caregivers understand why that might be the case. For example, in ear infections, not all ear infections require antibiotics. So by clicking on this link, it'll help us understand why antibiotics are not effective, as well as why using antibiotics when an infection is viral, meaning it is caused by a virus and not a bacteria. It will explain why that can actually expose the patient to harm rather than good. Similarly, it explain on why we should not be rushing to antibiotics for cold, flu, or other respiratory illnesses, and why antibiotics are not effective against viral infections. And it also explains why the overuse of antibiotics is a serious problem for public health. So, once again, these are meant to be educational resources. These are not meant to substitute the professional advice of a licensed healthcare professional. If you notice that your child is very unwell, they are difficult to wake, or are unusually irritable, if they are breathing fast, they're struggling to breathe, or if their breathing is noisy, if their fever is lasting more than 72 hours, or is accompanied by a rash, stiff neck, or dehydration, if you notice the child's symptoms get worse instead of improve, or if you have any concerns or you are unsure, please seek medical attention. We are here to help, and we are always happy to assess your child. Remember, you are the caregiver. You are the one that knows your child. It is always okay to seek assessment by a licensed healthcare professional. Thank you very much, and we hope you find this useful. Until next time.